There are hundreds of diseases within the world that have no cure, such as ankylosing spondylitis. Perhaps maybe you know someone with ankylosing spondylitis. This affects people not physically, but mentally as well. Some basic information. The definition of ankylosing spondylitis is the inflammation within mostly the spine, but there are other cases that involve the ribs, shoulders, hips, and knees. Some symptoms of ankylosing spondylitis are chronic pain in the back, neck, or butt area, as well as fatigue, fever, and loss of appetite. Some medical tests that are most likely going to happen when diagnosing of ankylosing spondylitis would be the x-rays of bones and joints to see if their inflammation has affected the bone area, blood tests to see if your autoimmune system is still properly functioning, and lastly, family history. This helps connect back to see if families have ankylosing spondylitis as well. The next question I usually get asked is, how do we get this disease? Well, there isn't a known factor of how this disease happens, but scientists have linked it back to genetic factors. The HLA-B27 gene has been known to affect people with ankylosing spondylitis. But however, 1 in 20 people with this gene actually possess the disease. There are other factors that play a role, such as the environment. When it is cold outside, the joints of our bodies tend to stiffen up and not be able to function as well. Treatment/doctors. So there is no cure for ankylosing spondylitis. There are only ways to treat the symptoms. And there are 4 different ways to do this: surgery, medication, exercise, and diet. Surgeries happen with hip replacement, knee replacement, shoulder replacement when the disease has affected the bone so badly there is no repair. Medications such as anti-inflammatory meds help the inflammation of the spine and back swelling go down. Exercise and diet are hand in hand. On the bottom left picture, exercise is shown through different stretches that are done for ankylosing spondylitis. Diet is another main part. There are three essential vitamins that are needed, such as vitamin C, vitamin E, and vitamin B6 to help the body's immune system function properly. There are many different people that live with ankylosing spondylitis and have different effects, and here is just one of them.
My immune system is my enemy. There are days that I cannot leave my bed. I have ankylosing spondylitis. My struggle is more than just aches or pains. I always had this very persistent pain in my lower back, and it really affected me because at that point of time because of that I wasn't able to train properly. There was this time the pain was so bad, I couldn't even get up from bed, I couldn't even roll over to my side.
So as shown in the example, ankylosing spondylitis can affect people in many different ways. There's physical and mental effects on people with ankylosing spondylitis, and they have to strive to change and adapt every day to live a happy and healthy life. Thank you.